It's day 13 of India's 21-day lockdown to stop the spread of the novel coronavirus. I'm Suraksha.
I'm Akhil.
Over the next few minutes, we will bring you updates regarding the spread of this virus across the country. Akhil, what do the latest numbers look like?
Suraksha, as we record this bulletin, 4,579 COVID-19 cases have been registered in the country. 4,121 people are active reported carriers of the novel coronavirus in India. 333 have recovered since they were first tested, and the death toll has climbed to 125. Among those who died due to the virus, 63% were in the age group of 60 years and above. 86% of the deaths were due to comorbidities. Of the COVID-19 positive cases, 47% are in the age group of less than 40 years, while 34% are between 40 years and 60 years. Until last night, 89,534 tests for COVID-19 have been done across the nation, among which 9,369 tests were done yesterday alone. The Indian Council of Medical Research has announced that it has expanded its capacity to diagnose and manage COVID-19. In the worst case scenario, it aims to conduct 1 lakh tests per day by increasing the number of labs, testing kits and machines. Currently, 136 government laboratories and 56 private labs together have a testing capacity of 18,000 tests per day. Additionally, ICMR has prepared a data portal for streaming the data collection from all the labs on a real-time basis. It has also procured 10 lakh RT-PCR kits used for diagnosis. Antibody test kits have also been made available but are advised to be used for areas reporting clusters and in large migration gatherings. ICMR has approved over 200 labs for COVID-19 testing through RT-PCR machines. Additionally, government and private labs, research institutes and medical colleges which have the capability and the infrastructure to undertake COVID-19 testing have also been identified and are in conversation with them to include them in the COVID-19 testing network. 1.70 lakh PPEs were donated to the government of India from China today. Along with domestic supplies of 20,000 overalls, more than 3.5 lakh PPEs are available in the country right now. An order of 80 lakh complete PPE kits have been placed on a Singapore-based platform and supplies are expected about April 11th. About 16 lakh N95 masks are currently available in the country and orders have been placed for more than 112 lakh masks and supplies are expected within a week. Maharashtra has reported 4 new deaths, all in Mumbai, and 57 fresh cases, bringing the total number of active cases to 680. In Kerala, 13 fresh cases have been reported. The state now has 266 active cases. Delhi has reported 30 new fresh cases today, out of which 10 are linked to the Tablighi event. The number of active cases now stands at 497. Andhra Pradesh has reported 37 new cases, bringing its tally of active cases to 294. In Gujarat, a 62-year-old has succumbed to the virus. The state now has 111 active cases. Karnataka has recorded 12 new positive cases. The total tally of active cases is now 139, with 4 deaths so far and 20 discharges. 3 patients are in ICU. Out of the 12, 7 belong to Mysuru, 1 belongs to the Nanjangud Pharma cluster, and 3 have a history of traveling to Delhi. 1 is a direct contact with a previously diagnosed patient, and the last has a travel issue to Dubai. 2 cases have come in from Bagalkot and are both direct contacts of patient 125 who died 2 days ago. 2 cases have come from Bengaluru and 1 case from Bengaluru Rural had attended the Tablighi Jamaat conference in Delhi. The Karnataka State Board of Waqf has disallowed prayers in all mosques and graveyards on April 9th on Shabi Barat. Any person from the state who has attended the Tablighi Jamaat congregation at Nizamuddin Markaz Masjid in New Delhi, kindly contact Arogya Sayavani on the number displayed on your screen. Those are the latest figures from India and Karnataka. Suraksha, back to you for the rest of the news.
Right, Akhil. Thanks for that. More than 2 months after the first COVID-19 case was reported in the country, teams fighting to contain it are facing with new challenges every day. In Delhi, according to figures available until Sunday evening, authorities have not been able to identify how at least 71 people contracted the virus. The focus in the capital has so far been on the cases related to the Tablighi Jamaat. On Sunday, for the first time after testing of Tablighi Jamaat followers started, the number of those not linked to the Jamaat surpassed that of the Islamic movement's numbers. Of the 58 cases reported on Sunday, 39 did not have any links to the movement. In Kashmir, a couple from Shopian district tested positive for COVID-19. 18 days after their return from a pilgrimage in Saudi Arabia, the couple had been quarantined for 14 days after their return, after which they had been allowed to go home. Doctors suspect that the couple were infected while they were in quarantine. Contact tracing has begun again, not just for the couple who tested positive, but also for all the others who had been quarantined along with them. Members of Parliament will have their salaries slashed by 30% this year in response to the situation arising from the spread of the pandemic in India. The President and the Vice President of India and governors of all states have also voluntarily agreed to a 30% cut in their salaries. The money will go to the Consolidated Fund of India. The Cabinet has also approved to temporarily suspend MP-led funds for 2 financial years. The funds will be diverted to the Consolidated Fund of India in order to manage the situation arising due to the pandemic in the country. On the occasion of BJP's Foundation Day, Prime Minister Modi has asked the party workers to make 5 vows today. The 5 vows include providing food to the poor, distributing masks to at least 5 people, and conducting campaigns to thank frontline health workers and the police force. He has also asked them to give information about the new app Arogya Setu to at least 40 people and inspire them to make a contribution to PM CARES Fund. The Life Insurance Council has announced that all life insurers, both public and private, are committed to process any death claim pertaining to COVID-19 at the earliest. The Council has announced that the clause of force majeure, which frees both parties from obligations if a major event occurs, will not apply in case of COVID-19 death claims. The Life Insurance Council is the face of the life insurance industry that connects the various stakeholders of the life insurance industry. United Nurses Association, a Kerala-based body, has filed a PIL in the Supreme Court with a demand to formulate a national COVID-19 management protocol after several doctors and nurses across the country tested positive for the virus. One of the demands is to expand the scope of the Pradhan Mantri Garib Kalyan package for health workers fighting COVID-19 to include healthcare workers across all sectors, including those recruited on an ad hoc basis. Days after it was reported that Maharashtra had denied permission to a Tabligh-like event to be held in the state earlier in March, NCP Chief Sharad Pawar questioned who had provided permission for the gathering in Delhi. While appreciating the decisions made by the Uddhav Thackeray-led government, he also criticized the media for targeting one community. After a tiger in Bronx Zoo in New York tested positive for coronavirus, the Central Zoo Authority in India has issued a circular to step up precautionary measures in all the zoos in the country. National Tiger Conservation Authority has alerted all the chief wildlife wardens of all the tiger range states in India to gear up the frontline staff as well as veterinary officials to detect the disease and prevent any spread in tigers in the wild. Moving on to the coronavirus operation in Karnataka, as the COVID-19 cases rise in the city, so does the demand for quarantine facilities. Even as the state government has notified 17 hotels in the city for setting up makeshift coronavirus quarantine facilities, the Bengaluru hoteliers seem to be unwilling to let out their hotels for the same. There are approximately 3,500 hotels in the city, and of them 580 hotels have standard features to be used as a quarantine facility. This despite the fact that the Federation of Hotel and Restaurant Associations of India had voluntarily offered the government access to over 45,000 hotel rooms from across the country yesterday. Till date, only 2 hotels, Hotel Viceroy in Mysore and Hotel Metro in Hubli, have voluntarily given their facility for quarantine. The Central Crime Branch Police have arrested a 53-year-old man selling various chemicals for the manufacturing of fake hand sanitizers. He had stored dangerous and highly flammable chemicals in a building in Sudamanagar in Wilson Garden. In Hubli, the Anjuman-e-Islam has asked members of the Muslim community not to venture out of their houses during Shab-e-Barat on April 8th and 9th and to follow all the rules of the lockdown. The organization has decided to perform the rituals associated with Shab-e-Barat on behalf of the entire community and has asked 130 mosques and dargahs to stay closed. Anjuman-e-Islam has also decided to intensify the awareness drive among Muslims about precautions to be taken to prevent the spread of the COVID-19 infection. Dakshina Kannada police have registered 4 criminal cases against people circulating derogatory posts on social media aimed at hurting religious sentiments. DKSP BM Lakshmi Prasad warned that mobile phones of those miscreants who post derogatory messages on Facebook, WhatsApp and other social media platforms will be seized and strict action will be initiated against them.
And before we go, here's some good news. You'll soon be able to see locations of food and night shelters on Google Maps. Google has said that this service is available in 30 cities across India to help people find essential services during the lockdown. To find a shelter near you, you just have to type food shelters or night shelters, depending on the need, followed by the city. The service will soon be available in Hindi, and the company is working towards bringing it in other Indian languages. That's all we have for today.
Stay safe, stay indoors, and we'll see you tomorrow.